Hi, my name is Cannon Fisher. I'm a student at Ouachita Baptist University, and this past summer I was able to do research here under the mentorship of Dr. Dieter Breck alongside my colleague Jorie Beaumont. So for our research, we did a systematic review of the nutrition-focused physical exam and assessment of malnutrition with a focus on the elderly. So this is what our poster looks like. So it's a normal poster: abstract, introduction, methodology, results, conclusion, acknowledgments. And so that will then bring us to our first point, is our research question. So our research question was, what is the literature available on the nutrition-focused physical exam in the assessment of malnutrition with a focus on malnutrition in the elderly? So that's a lot. So it was very specific and to the point. So we just wanted to know what is out there on the NFPE, specifically in the assessment of malnutrition and the older adults category. So we just wanted to, see what's out there, what's not out there, what are people's opinions, how are people being able to screen for malnutrition, are they using the NFPE, are they not? So that's basically what our research did, just seeing what people are using, what they're not using. So then that brings us to our introduction. So malnutrition in older adults varies depending on the area or community they live in. So it can be anywhere from 1% to 12 to 50% or 23 to 60%, just depending on where they are in their stage of life, if they are living independently, if they are in the hospital, or if they are in a long-term care facility such as a nursing home or some other facility that they are currently in at the time. So it varies, as you can tell. So it just depends on where they are in their stage of life. And then the NFPE could be used in hospitals, clinics, and long-term care facilities to improve the quality of life. So we do know that the NFPE is a very positive thing to use to screen for anything, but ours was mostly for malnutrition. But it is a very useful and beneficial tool to use to screen. And so then that brings us to our methodology. So we actually did 2 systematic reviews of literature, one on the nutrition-focused physical exam, which I'll talk about first, and then secondly, we did one on malnutrition in the elderly. So with our first systematic review, all articles that focused on the NFPE and were written in English were included in the review. So this one just focuses mainly on the NFPE. Was it used? How did they use it? Or whatever. So articles that did not meet the criteria, which was it focused on the NFPE and were written in English, were not included. So we had 50 articles through that. So we found 50 articles, and we used these 5 databases for both systematic reviews. So that was EBSCOhost, JSTOR, Google Scholar, ProQuest, and PubMed. So we found a total of 59 articles through EBSCOhost, but we were only able to use 11 of those. JSTOR, as you can see, we found 0. Google Scholar, we found 273 articles, but because of our inclusion criteria, we were only able to use 20 of those. And then with ProQuest, we found 376 articles, but we were only able to use 16 of those. And with PubMed, we were only able to use 3 out of the 10 we found. And so here is more of like a flow chart of how we excluded articles or took articles out. So the first thing we did is we took out duplicates, because you were going to find multiple duplicates no matter where wherever you found those articles. There were always duplicates. And then, so this one is in our education and training for registered dietitians and dietetic interns. So in that population, we found 25 articles, and then they were then broken up into intervention studies or non-intervention studies. And so then here, speaking of with population, is our 50 total, and then where they fell in with those populations. So as you can see here, 4 of those articles, that population was pediatric. 5 was the elderly. 15, they had the general population. That's what their article focused on. And then there was only one article that had athletes as their population of focus. And then again, those 25 articles that I previously talked about focused on training of the registered dietitian or dietetic interns, and then they were then broken up into intervention, non-intervention, and same for the rest of those. And so here, I just mentioned that we found 5 that focused on the elderly, and so this is their table that had their journal title, article title, and then their methods, their findings, and so that are those 5 articles and what they focused on, why they were written, and where they were written at. Where was it, a hospital, college? Where did this take place? And so that's that table that kind of just has it all kind of broken up. And so then this brings us to a very interesting figure that we made. It's the chronological order of the nutrition-focused physical exam of articles that have been published in the last 10 years. So, like I previously mentioned, the most that have been published is in education and training for the registered dietitians and dietetic interns. So you can kind of see when they really started to take flight of being published. And so in 2019 is the most articles that have been published with education and training for the registered dietitian, at a total of, I believe, 7. And then you have over here, this next line is the general population, and then you have pediatrics right over here, which has been on a steady off and on kind of flow. And then in 2019 they actually had 2 articles. And then you have the elderly populations or persons, and then in 2019 they had an article, and then they didn't have anything until 2016, and then 2017 and 2019 they only had 1, and then so far in 2020 they did not have anything. And then the last one is athletes, and there's only been 1, and that was in 2018. And so here, with those 5 articles I mentioned about the elderly population with the NFPE, 4 of those articles said that the NFPE had more accurate malnutrition diagnosis, and 1 said the NFPE led to reduction in malnutrition, which is very interesting and very good to see that it's a very accurate way to diagnose malnutrition, and it is reducing malnutrition in the elderly population. And also we saw that the NFPE had a 100% positive effect of malnutrition diagnosing. So it was seen positive 100% in all of our studies. So the screening effects were 100% positive, and that was a great thing to see. And so then that brings us to our second review of literature. So with this one, all articles that focused on malnutrition in people 65 years of age and older that took place in the U.S. and were written in English were included in this review. And if they did not meet those criteria, they were not included. And I believe that gave us a total of 24 articles for this systematic review. 16 included interventions, while 8 included malnutrition screenings geared toward older population. And so then that would bring us to this slide. So for the intervention studies, 6 articles used a multi-component methods for screening for their interventions, and then 2 had government programs, another 2 used protein supplements for their intervention, another 2 used calcium supplements, and then another 2 used vitamin supplements. Then 1 used metformin for their intervention, another used physical activity for their intervention, and then lastly, 1 used parental nutrition for their intervention. And so this figure shows the screening tools that places use to screen for malnutrition. So 2 articles used food questionnaires, another 2 used mini nutritional assessment short forms, and then another 2 used multidisciplinary assessment, and then another 2 used interviewing for their malnutrition screening tools. So that's the end of the results for those 2. And then so this is our conclusion. The NFPE literature search showed that the nutrition-focused physical exam is a very reliable assessment of malnutrition in all age ranges. We saw that, and not just specifically in older adults, but in all age ranges. It's a very reliable assessment for malnutrition. And then research studies found that the registered dietitian nutritionists are beginning to embrace the benefits of including the NFPE in their skill sets and their daily practice. The malnutrition intervention studies revealed that multi-component strategies that included both diet and supplementations are effective for improving the quality of life in patients. So with the supplementation and then you add the diet, that showed to have the most effect for improving one's quality of life. Non-intervention malnutrition articles identified very valuable screening tools to use. So if you didn't use the NFPE, it showed other ways to screen for malnutrition that were very interesting to read about. And then lastly, increased use of the NFPE in malnourished patients in the future will greater increase recovery time rates. And we saw that in our articles, that when they used the NFPE, you saw that their recovery rates did go up, and you saw a better just end results for those patients. And lastly is our acknowledgments. So we would like to thank the J.D. Patterson Summer Research Grant for giving us the money and for allowing us to do this. Same with Ouachita Baptist University. Thank you for allowing us to do research, especially during the summer of COVID, masks, socially distancing. And we would just like to say thank you to all of y'all for making this possible for us to do this research. Thank you for coming to my research. I hope you have a great day, and I hope you learned a lot. Thank you.